Mm. Okay, so good day, everyone. Uh, today we are going to discuss a very important topic in women's health. This is the hormone replacement therapy, commonly known as the HRT. So, as women transition through menopause, the body undergoes significant physiological changes. And our goal today is to understand how we can balance those hormones to improve quality of life. So understanding HRT. Now, before we look at the how and why, let's establish a foundation. So understanding HRT requires us to look at the endocrine system and how the decline of specific hormones affects the entire female body. So question is, what is HRT? So at its core, it is a medical intervention designed to replace the estrogen and progesterone that a woman's body stops producing in large quantities during menopause. So it is not a one size fits all fix. It is a personalized treatment intended to return the body to a state of physiological balance. Now, hormones can be introduced to the body in several ways. So we have oral tablets, which are familiar to most. We also have transdermal options like patches and gels that bypass the digestive system for direct absorption. Now, for those looking for long-term stability, subcutaneous implants can provide a steady release for several months. So, not all symptoms of menopause are systematic. So, for localized issues, particularly vaginal dryness or atrophy, doctors may prescribe targeted treatments like rings or suppositories. So, these delivery hormones exactly the delivery hormones exactly where they are needed without significantly raising hormone levels in the rest of the bloodstream. So the timing of the dosage matters. Cyclical combined HRT is often used for women still experiencing irregular periods. So it mimics the natural cycle by adding progesterone for a portion of the month. So continuous combined HRT is more common in post menopause. So providing a steady daily dose of both hormones to prevent any breakthrough bleeding. Let's go now to the utility of HRT. Now, why do we bother with these treatments, and what makes it such a useful tool for clinicians? So why is it useful? HRT is uniquely useful because it treats the underlying cause of menopausal symptoms rather than just the symptoms themselves. So by restoring estrogen level, we stabilize the body's internal thermostat in the brain. So this is why it is so effective at stopping hot flashes, um, night sweats, the brain fog, that many women find debilitating. Debilitating. So let's go to the benefits versus reasons. So looking at the science, the benefits go beyond just feeling better, of course. Estrogen is a bone protector. By replacing it, we drastically reduce the risk of osteoporosis. Furthermore, estrogen helps regulate neurotransmitters like serotonin, which explains why HRT can be a major factor in stabilizing mood and mental well-being. Now, who should avoid HRT then? So remember, the HRT is actually powerful. So which means it is not for everyone. So we must avoid this treatment in women with history of breast or ovarian cancer because these tumors are often hormone sensitive. So meaning estrogen can actually act as fuel for cancer cell growth. Similarly, we avoid it with unexplained vaginal bleeding because we need to rule out existing cancer before introducing hormones that might mask or worsen the condition. Analyzing potential risk. So every medical treatment has a risk benefit ratio, of course. For HRT, the risks include a slight increase in blood clots or stroke, particularly with oral versions that affect how the liver processes clotting proteins. So there is also a noted link to gallstone, and with long-term combined use, a slightly higher risk profile for breast cancer. But we also have, of course, alternative approaches. So for those who cannot take HRT due to the risk we just mentioned, we don't leave them without options. Lifestyle changes such as calcium-rich diet, weight-bearing exercise, and avoiding triggers like caffeine, and which all of this can manage symptoms. So herbal supplements also and specialized cooling environments are also part of the holistic management plan. So question about this, you can send me a message. But we have covered the biological, why, the medical, which is the how, and then the safety, that is the who. So if you have any question one more time, you just send me a message or we can discuss it during our meeting. Thank you very much and see you.